Hello everybody, it's Coffee Mud here. This video is the part 2 of medical robots. Here we are going to review 8 amazing robots and explain the advantages of each. These robots are revolutionaries of medical industry that we will hear more about in the near future. Here, we briefly state their most prominent features. Disinfectant spots. The unfortunate truth is that hospitals are extremely dirty places. You may go there for treatment, only to leave with an entirely new sickness. And since hospitals routinely administer large amounts of antibiotics, they can become a breeding ground for some of the toughest antibiotic-resistant bacteria around. That's why it's so important that hospital rooms be clean. But why leave that cleaning up to error-prone humans when you have a robot? Modern disinfecting robots move autonomously to rooms of patients being discharged, then bombard the empty room with high-powered UV rays for several minutes until no microorganism is left alive. Telepresence Robot. You have probably seen a telepresence surrogate before as the butt of the joke on a TV show or in a trendy startup office. They look like iPads set on top of the mini Segway, which is inherently silly. But the truth is, they have actually found a key role in the medical field as a way to bring top doctors and diagnostic expertise to underserved communities and far-flung parts of the world. Doctors in New York are now able to speak with patients and local physicians in rural India, sharing their knowledge and consulting on diagnosis in real time for a fraction of the cost and effort of having to travel there in person. So, silly as it may seem, it's entirely possible that your next annual checkup might be with a remote-controlled tablet instead of physical person. Robotic nurses. Nurses are miracle workers and the true lifeblood of any medical setting. But they are also hopelessly overworked and chronically short on time, not to mention in short supply in many places. That's where robotic nurses come in. For the most part, these are systems that can fill out digital paperwork, take measurements of vital signs, and monitor a patient's condition. Some new robotic nurses have taken aim at other menial tasks that nurses get stuck with, like moving carts from room to room or even drawing blood. At the end of the day, if it's saving nurses time and allowing everyone to take better care of the patients, we are all for it. Pharmabotics. Think of this basically like a really big vending machine, but for drugs. Honestly, this is one of those inventions where you hear about it and think, oh yeah, it's not like I need a physical person to count out and hand me the pills my doctor prescribed. How come that doesn't exist yet? Well, it exists now. A proof of concept pharmacy has been operating flawlessly at the University of California, San Francisco for almost 5 years, and more have been approved for hospital use. Artificial intelligence diagnostics. This is perhaps the task in which robots can do the most of medicine. Using machine learning, scientists can train an artificial intelligence to perform a task better than a human by essentially providing it with thousands of examples. The New York University team that created an artificial intelligence capable of scanning thousands of medical documents to pinpoint patients at risk of developing diabetes, heart failure, or a stroke. In the future, robots may be the first port of call for giving a diagnosis. Artificial intelligence epidemiology. Artificial intelligence can be very good at seeing patterns and making predictions from data that would be simply overwhelming to humans, which is why epidemiology was a logical target for a new artificial intelligence system. We are already seeing artificial intelligence-enabled robots being used to fight the pandemic. These algorithms analyze data on disease outbreaks from doctors on the ground and cross-references that with all available medical databases to predict when and where an outbreak is happening, as well as how to keep it from spreading. Antibacterial nanorobots. Antibacterial nanorobots are tiny machines made of gold nanowires coated with platelets and red blood cells that could actually clear bacterial infections directly from a patient's blood. They do this by basically mimicking a bacterium and its toxins target, then ensnaring them in their nanowire mesh when the bacteria gets near. They can even be directed through a patient's body with targeted ultrasound to speed up the clearance process and to treat localized infections. Best of all, because they take advantage of bacteria's natural response to clear them from the system, nanorobots could potentially be used in place of broad-spectrum antibiotics, which could have an immense impact on our fight against the rise of antibiotics-resistant diseases. Companion bots. Not all the medical problems robots can fix have to be life-threatening. The fact is that there are millions of elderly, infirm, or mentally disabled people in the world who suffer from chronic loneliness and lack stimulation. These patients also tend to be people who require regular check-ups from caretakers, which can be a problem in areas where there are shortages of professional caretakers. Companion robots solve both of these problems at once and are truly making life better for a lot of people. I hope you enjoyed this video. Thanks for watching.